Hi, everybody. Welcome back to another live conversation with us. This is our daily conversation where we answer the many questions that are racing through your minds right now. So I am with Olivia. She is one of Stream Dental HR's brilliant strategists. She has 12 years of experience as a chartered HR professional and is SHREM Senior Certified Professional as well. So if you guys have any questions, please, this is a live conversation. We want to bring you in. We want to answer your questions. So make sure to type them below. So in that way we can get to those and give you those answers in real time. So today what we actually want to focus on is we already have a couple weeks under our belt after COVID-19 has broken out. All of the changes have impacted our business, closing down for a bit, maybe temporarily laying off our team. And maybe we're starting to have that time where we're actually sitting down and reflecting. And maybe one of the thoughts that are going through our minds right now is, what could we have done differently in the face of this emergency, this pandemic? What has COVID-19 taught us? And so that's what we're going to be talking about today in our conversation. So I'm going to throw that at you, Olivia. What are some things that COVID-19 has taught us when it comes to HR?
Well, like you said, Samantha, the last few weeks have been crazy. It's been exhausting. It's been scary. It's been tumultuous. It's been uncertain, and probably a bunch of other adjectives, and also a fantastic learning experience for what we can do better in the future. So first of all, let's talk about employment contracts or employment agreements. Now, this pandemic has made many practice owners look over their employment agreements to see what was really included in the contract to protect the practice in the event of a circumstance like this. So for example, you need to go through your contracts and see, does your employment agreement have a temporary layoff or furlough clause in case there is some sort of emergency that requires you to close the practice for a period of time and request your employees to take a period of unpaid time off? Or even further, do you even have a written employment agreement? Because, we sometimes see practices that have been in business for 20 or 30 years that still have an original employee who never signed an employment agreement when they started with the practice in the first place and haven't implemented a written contract in any of the time since. They had that initial handshake and that was it. So one thing to keep in mind before you come back from this leave and try to implement new contracts for your team, because this seems like the best time to say, we don't have any written contracts, let's implement them now. Remember, you have to provide something as adequate consideration before you can offer a current employee a new contract. So basically, consideration is a legal term that describes one of two instances. Either you have a promise to do something that you are not legally required to do, or you have a promise to not do something that you have the legal right to do. So usually consideration in this case, when we are talking about employment contracts and taking an employee from a verbal contract into a written contract, would be something like a raise or potentially a one-time sizable signing bonus or an increase in paid vacation time. So those are the most common ones. But it's important to remember that signing bonuses must be related to the employee's current length of service at your organization. So for example, a $50 signing bonus isn't going to cut it for an employee that's been with you for 15 years, but a $5,000 signing bonus plus an extra week of annual paid vacation time might be considered sufficient. So overall, if you were thinking that when you reopen your office is the best time to convert from a verbal agreement to a written agreement, make sure you talk with your employment lawyer to ensure that you are offering an appropriate agreement to your presently hired employees. Now, also with employment policies, we've seen that there's been a struggle for many offices for the last couple of weeks as they have been strongly recommended or even mandated to close. So specifically, I would recommend reading through your employee handbooks and seeing that you have an emergency office closure policy, a temporary layoff or furlough policy, and a change of hour policy. As well, most offices don't have a remote working policy in place because the nature of the work is not generally off-site or outside of the practice. However, now we're seeing plenty of administrators, front desk staff, and even some assistants and hygienists doing work from home as they use this time to catch up on paperwork that has been piling up for months or years. So make sure if you're implementing a remote working policy that there is a strong reminder of the importance of your commitment to privacy of your patient information, and that you'd probably be best off creating a VPN for your team to access these files outside of the office.
These are all amazing points. And like you said, now's that time to be able to, take a look. And if that employee handbook is, like Olivia mentioned, if we opened the practice about 10, 12, 15 years ago, and that employee handbook was the original, the OG paperwork from that time, we want to make sure that it's updated. Now's that time to take a look. And all of those policies that you mentioned, Olivia, are fantastic. And like you said, knock on wood, hopefully we never have this global pandemic happen again.
Exactly.
But there are going to be some situations where we may have to close down. Coming to think about here in Calgary, we had that flood. And our office was located downtown, and we weren't able to go in for many days and weeks. So just even having this to cover any natural disasters or anything that could potentially cause us to close down the practice. So thanks for highlighting all of those points. But another thing that comes to mind as well is, the standard of infection prevention, the standard of, making sure that we're preventing and ensuring that we're providing a safe and healthy work environment, not only for our patients, but for our employees. So what about occupational health and safety policies and procedures? We've had a lot of practices asking about how to use this in terms of infection prevention control. Is that enough just to have that IPC manual?
Well, infection prevention and control is fantastic for just what it says, for preventing infections in the workplace. IPC manuals are common in dentistry, healthcare, and any other industries that are working with people who may spread disease. Now, this has been helpful in the face of a pandemic and generally provides more infection-specific information than an occupational health and safety manual would. However, there are many other reasons that an office may need to close for an emergency that would not be regulated by your IPC manual. These could include fires, like you just said, floods, natural disasters, evacuations, or any sort of lockdown, like a hold and secure, a bomb threat, or a threat of any other kind of workplace violence. So now all of these policies and procedures are honestly more likely, based on our history, to take place than a pandemic is. So this is not to say that we will never have another pandemic in the foreseeable future, but statistically speaking, you're way more likely to need to close because of a fire or a flood than a pandemic of this capacity. So this is where your occupational health and safety manual would really come in handy, as this manual will hold all of your policies, procedures, and documentation for all of these events that are more likely to occur in the future. But really, for anybody watching, have you ever thought about what the procedure is for your office if you ever needed to go on lockdown for whatever reason? Just for an example. And beyond yourself as the owner knowing what to do you know that every single member of your team knows what the procedure is? And I'm going to guess likely not, because we think that these events are like freak accidents or random occurrences. And this is why we're always in a reactive state when these things happen. So I'm not saying that you need to prepare for doomsday every single day, but we definitely need to be aware of these things because it is important. And this is why our kids at school, they always have fire drills, because it's important that everybody in a school knows what the appropriate protocol is to ensure that everyone's safety is of highest consideration. So likely we're going to see more stringent disinfection and sterilization requirements once we are operating again in the near future. So if you do have a current occupational health and safety manual, make sure that you update it based on the new standards that will likely be appearing, and ensure that your whole team is trained on any new standards that you'll be putting in your manuals.
Those are all great points. And I love how you mentioned, we did this all the time in school, right? We had to do it at least, a couple times a year. And that's a great point to highlight, that this is the same kind of care and training that we need to provide our employees. So in that way, if there was any situation that would happen, they've received the training, they know the protocols.
Exactly.
And we've got all of that documented to show that, hey, I'm doing my due diligence to provide a safe and healthy work environment for my employees. So that is you're on a roll today. Those are great things to keep in mind. So that's a lot more about the policies and the procedures and the paperwork within the practice. But did you notice anything else that was prevalent in the last 2 weeks in terms of the communication with practice owners?
Yeah, absolutely. It's been a busy week, as you know. And I think the lack of contingency planning across the industry as a whole was something that no one really ever saw coming. So based on your region and the appropriate legislation, there are certain requirements that we have as business owners if we have to close our doors for some sort of emergency. And I don't think that many practice owners were ready for what that commitment would actually look like. So, for example, right now in the States, we are currently waiting on an exemption to the FMLA for dental offices with under 50 employees to try to lessen the financial burden of what is expected of these practices to pay employees when there is an increase in government funding available. Now, realistically, you need to create some cash flow or some kind of rainy day fund for when disaster strikes. You absolutely need to keep enough cash to cover your payroll for at least 2 weeks. However, if you can, more like 2 months is recommended. And this kind of savings, excuse me, doesn't happen overnight. It's important to remember that it takes a while to build up this kind of reserve so that you can operate with less worry and less devastation if something like that FMLA exemption was not to be accepted. We can't rely on those exceptions.
Yep.
So as well, remembering that in the event of disaster, these funds disappear quickly and will again take a long time to build back up. And as we just heard about an hour ago, the Canadian government just announced, excuse me, another boost for compensation support of up to a 75% wage subsidy and guaranteed interest-free loans. And it's exciting to hear that this policy is going to be backdated to March 15th, as I know many small businesses have been drastically affected in the last 2 weeks and weren't sure, even with the increase of support starting in April, if they would be able to come back from the financial devastation that they had encountered over the last 2 weeks. So overall, we're also noticing a lot of practice owners start to contact us with questions about what do I do when we are given the clearance to reopen, which is fantastic that you are thinking ahead of time and starting to plan out what that return to work is going to look like. So this is where having a return to work protocol will be important with policies about work sharing or reduced hours. It's hard to know how long it's going to take us to get back to regular operations and regular patient flow because there are so many unknowns, but it's important to start asking some questions like how many hours of patient appointments are going to need to be rescheduled. Once we reopen, how many patients do we think are going to postpone their appointments because they're still nervous about the entire situation? Should we open for extended hours to reschedule as many of our canceled patients as quickly as possible? Or should we keep our same hours and assume that we're going to have more patients cancel their future appointments because they're still leery about the pandemic, even once we've been given the clearance to reopen? So this is the time right now where you need to be proactive and start making some calculations about your reopening hours and how you're going to staff your practice. So you could have your whole team come back on a part-time or reduced hours function, or have a few employees come back full-time. But overall, all the needs need to be determined based on your existing policies. So even more important than that, talk with your team, communicate with your team, and see what their thoughts are on getting back to work. Communication is really going to be key to getting back to where you were once before we even knew what COVID-19 was. So you might have some employees that are happy to go part-time for a while during the period that you are getting reorganized and back to your regular flow. And you also might find that you have some employees that financially really need to get back to their full-time hours, or they could be in some serious financial hardship. So overall, remember that you're a team and that you need to work together on getting back to your regular schedule as soon and as safely as possible.
Those are all great points. Like, definitely now's the time to be able to just really consider and starting to prepare for that and really put those contingency plans in place. Because like you said, there's a lot of things that are unknown. And I feel that that's kind of been the environment and how things have basically drastically changed literally overnight a couple of weeks ago, and things have been changing hour by hour, day by day. And so I feel, sometimes because of that, there's so much uncertainty, which then leads to anxiety, to overwhelm. And sometimes we may be making some decisions in panic mode, reacting to this type of pandemic rather than being prepared. So what do you see that some of these practice owners can do and try to be able to react and be a little bit more prepared?
Right. And as terrible as that sounds, it's definitely the truth that we have all been in panic mode because this is unknown. This is unprecedented. We don't know what to do. So it's taking it day by day, hour by hour, and knowing that there's more updates coming and just trying to stay as well informed as we possibly can. And we know that many practice owners have spent much of their time and finances on call with their employment lawyers because they didn't have any formal written employment agreements in place, or they had no furlough policies or remote working agreements. And honestly, the last couple of weeks have been messy, for lack of a better word. And as we've all been scattered to try to provide as much help and service to practice owners as a whole, when proper policy implementation and formal contracts could have really saved a lot of time and panic and financial burden and worry. So throughout this whole process, we need to make sure that we're acting as safely as possible and based on the current legislation in order to avoid these future accusations or lawsuits based on any constructive dismissal, wrongful termination, and discrimination. So I know this has been a terrible situation, but it's also a great learning experience to prepare for those, like I said before, those more statistically likely occurrences to happen rather than another pandemic.
Yeah, definitely. Like, I think we can all summarize it in saying that having a contingency plan, being proactive, is really best practices for a business,
Mhm.
right? So, is there any other issues that you have noticed that has or could have we could have done to be able to prevent an increase in preparation for this type of disaster of some sort?
Mhm. Yeah, for one, I can say that pretty much every small business owner with employees has had at least one moment of panic in the last 10 days, not just specific to dentistry, but literally every small business owner has gone, oh my gosh, what do I do?
Mhm.
It's been such a scramble to figure out what to do with our employees. So we're asking questions like, do we lay them off? Are we able to move them to some sort of remote work? Do we activate our furlough clauses if we have them? Do we keep paying them in full if they're on salary? Basically, what are we supposed to do at this time? So now I'm not saying that having disaster management policies that your team is aware of would solve all of your problems and dissolve all of your panic, but it certainly would have helped to alleviate some of the stress and worry that we've all felt in the last 10 days. Also, again, across pretty much all small businesses, we've noticed the issue of getting enough supplies. And I'm not suggesting that you need to keep a stock of 200 rolls of toilet paper in your office, but definitely making sure that specifically for dental practices that you have enough PPE to ensure that your staff will be protected for a few weeks in the event of full operations and no supplies being able to be ordered. So it's really important to be able to sustain for a while without any incoming supplies because you never know when there could be a shortage in the market that creates a problem for your ordering for the next few weeks.
Man, there's so many great points that you brought out, and just in terms of contingency preparation, being proactive, risk management. These are all the things that unfortunately we're not taught in dental school. So these are great points, and like you said, this is a great opportunity for us to use this as a learning opportunity to be able to see what has this pandemic taught us, for us to be able to see how can we come from this and become even stronger as a business and take this as a page out of that book to be able to see and prepare for, the next situation. And we know that may happen again in a different form, but at least we have all of these pieces in place. So thank you so much for coming on and just dropping so many amazing points for all of us to take home and really start seeing how can we make those changes and these needed adjustments in our business right now. So thanks so much for joining us. I really appreciate it, Olivia. I know
No
you've been
problem.
super
Happy to
busy.
be here.
Thanks so much. I appreciate it. And thanks everybody for tuning in. We had quite a few people giving us some hearts and watching right now. So if you guys have any questions, I don't see any questions right now, but if there's anything that comes up, please feel free to reach out to us here at Stream Dental HR. We are here to help. Thanks so much.